So for the next couple of slides, I'm going to talk about how to randomize a study participant. As you remember, this is a 24/7 study, and patients may come in after regular business hours, at nights and on weekends. And we just wanted to present a couple of slides for how do you randomize somebody if it's after hours. You just need to get the elements that are key to randomize an individual and get them on study treatment as quickly as possible. So these are the key elements. I'm going to talk about them in a little bit more detail later. The first is you need to add a new subject in our electronic data capture system called ESOCDAT. You need to complete the informed consent and demographics page. You need to complete the inclusion-exclusion criteria forms, which are on the Visit 1 page 12 and 13. You need to complete the randomization form where weight needs to be entered. You need to enter a study drug order in the standard electronic medical ordering system that you have for ordering drugs in your institution. You need to contact a pharmacy to find out the email address of the person who will be preparing the medicine. The rationale for that is they will get a copy of the study group assignment with the dose and what drug to be given to the patient. And so they will get that. And so their email address needs to be entered into ESOCDAT, and I'll show you where to do that. I need to confirm with the pharmacist that's preparing the study drug that they have received the order and the randomization email. So the first part is informed consent and demographics. First thing you do is you add a new study subject from the main menu. You complete the consent and the demographics page. Click Submit at the bottom right-hand corner to enable access to the inclusion and exclusion criteria. The participant ID is created after a form is submitted. The page does not need to be signed prior to randomization. There's a signature part at the bottom. It does not need to be signed prior to randomization. Next, you navigate to the baseline visit to access the inclusion and the exclusion criteria forms. To navigate to the inclusion criteria form, you go to the baseline visit and go to page 12. And you click on all of these inclusion criteria, and then you press Submit. The next page is the exclusion criteria, which is on page 13 again of the baseline visit. You click all of these elements, and then you press Submit. To navigate to the randomization form, you click Submit on those pages 12 and 13 of the inclusion and exclusion criteria in the baseline visit. And you will see a note which says the page has successfully been saved. Next, you go to Visit 1, Dose 1, page 3, which is the randomization form. All fields must be completed, including the eligibility confirmation, the weight, and you need to check off the box which says randomize the patient. As we spoke earlier, we need the email address of the pharmacist who's going to be preparing the study drug. The reason we need that email address is that they will get an email confirming a participant is randomized. They will get an email saying what group they are randomized to and what dose of study drug needs to be administered. You will not get that email because you are blinded. So you will not get an email saying what study group the patient is assigned to. Instead, you will get an email saying, congratulations, a participant has been randomized to the Atrium trial, and it will provide their study ID, and that email will come from the Atrium team. So that is the end of our slides about randomization and how you can complete the randomization. There are many elements to the ECRFs that need to be completed. These can be completed retrospectively after a patient is randomized. These last few slides were a way of getting you to the randomization page should this be off hours, at nights and at weekends, and a patient needs to be urgently randomized. Thank you for your attention.